The IMF, according to reports, denied the charges, quoting the World Bank data to support its argument that its programs contributed to significantly improved health in Guinea, Sierra Leone and Liberia. Last month, the G20 welcomed a commitment from the IMF to provide about 19 billion rand in extra funding to help fight Ebola. But the funding came with a combination of concessional loans, debt relief and grants. The IMF says its lending requires governments to prioritize short-term economic objectives over investments in health. It says civil wars in Liberia and Sierra Leone also helped destroy the country's health systems. Two new cases of Ebola have been reported. A health worker who returned from Sierra Leone is being treated in Glasgow. The only previous victim of the fatal disease in Britain was a nurse who contracted Ebola while treating patients in Sierra Leone. He recovered after treatment in London and returned to West Africa. And the Cuban doctor who also contracted Ebola in Sierra Leone was flown to Switzerland for treatment. He was a member of the 165-person medical team sent to Sierra Leone from Cuba last year. The doctor says he will return to West Africa to continue to fight the virus. Meanwhile, the U.S. Food and Drug Administration has granted emergency approval to a new rapid Ebola test development by a Swiss pharmaceutical company. The tests by the company gives results in about 3 hours. They can be used on patients with signs and symptoms of Ebola. Since the outbreak began in December 2013, there have been more than 20,000 cases and more than 7,800 deaths. Lehana Tsotetsi, SABC News.